And hi, everybody. Welcome to our weekly webinar here at Sex and Relationship Healing, the Addiction Q&A webinar. Pleasure to be here. I am going to talk a little bit about a topic tonight. And as usual, the questions that you may have may directly relate to what I say or not. And anything is fine. We're here to answer whatever questions you would like to have answered. But I do want to talk about a specific topic tonight. And that topic is what we call post-acute withdrawal syndrome. It's an interesting phenomena that occurs. It's a set of symptoms and issues that can happen months into recovery from addiction. I just want to talk about a little bit to help people kind of prepare to what they may encounter. It's not destined by any means, but it may. You know, with drug addiction in general, and then with sex addiction also, these symptoms can persist. Everyone knows, of course, about withdrawal symptoms that happen directly from certain drugs. And certain other drugs like amphetamines are said not to have withdrawal. But we do know that both amphetamines and sex addiction and porn addiction, for that matter, do have a certain set of kind of behavioral withdrawals that happen. And those happen in the moment, soon after somebody gives up those behaviors, but also can unfold over a period of months. And it can help to kind of understand what these are and really know what to expect. This is not a medical diagnosis. Post-acute withdrawal syndrome, it's not something that's official, but it is named, it's out there in the literature, and it is observed and something that we recognize does occur. First recognized through alcohol as far back as the 1990s, and now it's more commonly observed in everything. I want to talk about this, you know, the two things I would just run parallel with on the short-term withdrawal for both meth, which is said not to really have an addiction withdrawal piece, and porn addiction, and how parallel they are. Just to give you an idea of how everybody is affected by this, whether you're a sex addict, a porn addict, or a drug addict. So for both porn withdrawal and amphetamine withdrawal, within 48 hours, what can we expect? A lot of mood swings, some, I guess you could call grumpiness, headaches, anxiety, a lot of craving. Sometimes they call it a 7-day craving because it goes pretty intensely for the first week. For 1 to 3 weeks after porn or after meth, this is like zombie-like state. Again, not a medical term, but a pretty accurate descriptive sometimes, this kind of zombie state. Low energy levels, which can last longer than that. Inability to focus, really kind of scattered, fuzzy. Social awkwardness, low sex drive, loneliness. People are becoming aware of feelings that can occur. And then 30 to 60 days out from porn and both meth, random temptations, outbursts of overwhelming emotion, insomnia, and so on. So that kind of sets the stage for post-acute withdrawal, which happens with all these addictions. And it's really a cluster of different symptoms that you should just be aware of that may be part of your addictive behaviors. Long after the drug is gone from your system, long after you're no longer acting out, these things can persist for a while. What are these things? Irritability and hostility, just kind of feeling kind of funky and having a little edge all the time. Depression, depression and anxiety both, two really strong feelings that start to emerge. A lot of mood swings, feeling great one minute, feeling crappy the next, in tears one moment, indecisive the next, just kind of all over the place, which is pretty normal. Low energy, a lot of fatigue, a lot of sleep disruption. On this webinar before, both Scott and I have talked about just the persistent sleep troubles. My first 2 years of recovery, I think I did not sleep a wink. That's how it felt. It wasn't true. Limited ability to focus. This is, we've talked here before about some of the brain stuff. The brain is healing, and there's a lot of just fuzziness. People often, especially too with porn, sex addiction, and chemsex, people have trouble reading, concentrating. That verbal memory, what psychologists call verbal memory, has affected our abstract thinking. Lack of libido from that stimulation that has to kind of reset. We've talked about rebooting the brain. And finally, this kind of inexplicable chronic pain. I had a sponsor once, really wise sponsor in early recovery, tell me almost any weird physical symptom you have probably is related to your somehow post-acute withdrawal. I would have weird stomach cramps and muscle aches and all kinds of weird things that happen. They come and go, transient. They wouldn't really affect me in a bad way. So that kind of gives you an idea of the breadth of post-acute withdrawal. So what can we do for it? What's the remedy for some of these things? One is to educate yourself about this and know what to expect. I really think it's helpful if we have information and we can sort of prepare. and also then understand that, sleep, the great frustration of not sleeping well, maybe that's kind of normal for what we've gone through. I think to celebrate every accomplishment that we do. Sometimes recovery from these addictions is slow. We're in this state, basically our brains are in a state where we have a hard time experiencing pleasure, feeling excited about anything. And so it's really important, I think, to really at least acknowledge the successes. If you're a porn addict or a meth addict or any other kind of addict, being clean for a day is something to celebrate. Being clean for a week is fantastic. Being off porn for 2 weeks, a month is amazing. And just so we have to really kind of acknowledge the hard work, because it may not translate to how you're feeling. You may still feel kind of crappy and moody and grumpy and irritable, but you're doing good things. And so I think just to really kind of persist in spite of that. Patience. Patience is something a lot of addicts, especially sex addicts and amphetamine addicts, have in low supply. And I think learning how to have patience is really important to kind of take the pressure off, honestly. Find natural ways to help with sleep problems. I would take warm baths, non-caffeinated tea, do some meditation, cut off the news or TV, eating, before an hour before bedtime, that kind of stuff, what we call sleep hygiene. And if you Google the words to sleep hygiene, there's all kinds of great suggestions there. Exercise is an amazing thing for post-acute withdrawal. Healthy diet, really kind of treating our bodies well, taking care of them. The other thing to expect here is that other kind of co-occurring disorders may emerge, right? So we remember addictions are all about medicating ourselves, medicating uncomfortable feelings, medicating moods that we don't like. And so if we give up those behaviors, sometimes we may find that we have a lot of anxiety, and the anxiety kind of sticks with us, and we have to deal with that as a separate issue. Or we may find that our moods are persistently low, and that may also need to be evaluated somehow. So as I say, post-acute withdrawal is more about fluctuating moods up and down, but if some specific mood sets in, then that may be something that's kind of emerging that needs to be addressed. Then two things more: one, managing impulses, learning how to really manage impulse controls, how to manage triggers and cravings and resist those, and have that emergency exit plan where you can, if you find yourself getting close to acting out, you have a muscle memory embedded plan of what you're going to do, and you do it automatically. You follow through, just like you would a fire drill. And then finally, a word that we talk about here, I'm sure every week, connection, right? To get connected with mutual support groups, to have people you can talk about this with. I found it tremendously helpful, and when I was experiencing a lot of post-acute withdrawal, if I had somebody to share these things with who kind of understood and could at least affirm what you're going through, it's very, very helpful. So that's kind of a list of ready things to do, but I think it's important. We often hear that porn and sex addiction have no withdrawal, that amphetamines have no withdrawal, and they may not have withdrawal like heroin or alcohol, but they certainly have a lot of impact, and our bodies go through in a really extended period, our bodies and our minds, of healing and getting past that. So that's it for post-acute withdrawal.
Thank you, David. The concept of post-acute withdrawal, when I first heard it, I was like, oh, well, of course. Just like early withdrawal makes sense to me, because our addictions are our coping mechanism for everything emotional and a lot of times everything physical. I would be sick at work and I would leave and I would never make it home because I would start acting out and then feel better, and with the adrenaline, and it was just I never dealt with anything, and so initially I was just really restless and irritable and discontent, and then the other symptoms that you described really kicked in down the line. So a couple questions for you real quick. How long does post-acute withdrawal usually last? Like, when does it tend to kick in and when does it tend to let up?
So it tends to kick in probably around the 30-day mark. There are some periods with really kind of an acute withdrawal, and I'm talking even the psychological stuff, the first 2 weeks basically. And then weirdly, there's a little bit of what we used to call pink cloud. I think people kind of have this little bit of a honeymoon where I think our bodies are so happy and our minds to be beyond this addictive behavior. There's a brief kind of respite of like almost a euphoria. And then I think there's a more of a long haul kind of thing sets in. But the post-acute withdrawal really typically starts around day 30. And I think most of the time lasts maybe 6 months, maybe sometimes longer in certain cases. But I think most people have those symptoms kind of resolve after about 6 months, or by 6 months, I should say. Some people are quicker, some people are longer.
Thank you. You mentioned kind of depression and anxiety and an inability to experience pleasure can be part of this. Is that, we've talked about anhedonia on this webinar before, struggling to experience normal pleasure and how that's related to the brain, and the brain can heal over time. Do you think that the damage we do to our brain with the addictions, and particularly the brain's pleasure center, and the need to heal, does that factor into post-acute withdrawal?
Yeah, most certainly. And there's I think a lot of processes that we don't even fully understand, right? Because there's that reward circuitry, that the dopamine system, and all that is certainly affected by addiction, and has a long period, in some cases up to 24 months with meth users, chronic meth users have an even longer time for healing. Now, after, usually 6 to 12 months, people start to feel normal, but if we were to look at their brains under scans, we'd see that they were still healing, but it's not perceptible to the person. But there's other brain things that are healing, right? The prefrontal cortex, for example, kind of almost goes offline during the addiction. And that's our center that, is our executive controls, right? They control impulses and monitor moods and predict bad outcomes for behaviors and that kind of stuff. And so that's basically kind of coming back online. And so there's a lot of changes going on that do factor in, most definitely.
Thank you. And then I'm going to preemptively ask this question because somebody will ask it for sure. Medications to deal with post-acute withdrawal. Yes, no, maybe, depends. Never, sometimes.
Well, maybe slightly. I think it's so important for us addicts to really try to get through these without turning to an external drug or behavior to cope with it, right? That's our MO has been that. So I would definitely check with your doctor, a doctor who's savvy about addiction. I believe it was last week, we talked about outing ourselves to our doctors so that they know, that, oh, you could use how about a little Xanax to help you sleep? No, that's not a good idea for us. So we really need to be wise, be honest, and hopefully our providers will help us out with that. I've seen people, if they really can't sleep and it's really interfering, something like Benadryl, but I really even hesitate to get in that mindset of medicating to fix it. Now, headaches and stuff, Tylenol or Aleve, there's basic stuff that I think are not mood-changing things, but I really, without trying to be too stoic, I think it's important to kind of get through it without adding something to the mix.
Yeah. Now, if somebody's already on an antidepressant, they should probably stay on it, or?
Right. So, and this is again where, we really need to work closely and collaborate with our healthcare providers. If you're on some kind of mood stabilizer or antidepressant or something, I think it's really important to stay on it. What's interesting is that oftentimes you may see your need for those lessen without the addiction on board. So there will be changes in that regard too. And oftentimes people give up their, or sometimes I should say, people will give up their antidepressants. They find they don't need them anymore. But,
yeah, that was what happened to me. I was on an antidepressant, got sober and found that I didn't need it anymore because without the addiction, I wasn't engaging in behaviors that caused me to be depressed and anxious all the time.
Exactly. Now,
at various points in recovery, I have gone back to the doctor, but situationally.
Yeah, me too. Over the years, I think that's kind of normal. But please, with the medications, don't go on them or off them without really talking to your doctor and talking it through, so everybody understands what's happening.
Yeah. Okay, so we've got a bunch of questions already. So, hello, Dr. Fawcett. I am a gay man and I have an addiction to meth and sex. I was a sex addict long before I used meth. I made many attempts to have an initial 90 days of sexual abstinence, including no masturbation, but I've not been able to get 90 days in the past. Which factors determine how long this abstinence period should be and what kind of sex can be introduced after that period?
Okay, that's a great question. You know, we talk about this period of time of abstinence with no masturbation, no sex, where the brain kind of readjusts, recalibrates to arousal without that intense stimulation of drugs or sex and that kind of thing. So there's no hard and fast rule, you know. So for some people don't need to do it. Some people take a month, some people take 90 days, some people take 6 months or a year. It's kind of highly individual on that. I think it's a problematic, I think, if people kind of constantly try and can't do it and drop into shame and get into a spiral of kind of feeling bad about themselves. That's really kind of counterproductive. What we're trying to do is give our brain a chance to not being constantly lit up with those old kind of arousal patterns that have to do with drugs and sex. And basically, we know that one of the great things that help with that is time. And that's where the 90 days comes in. So it does help. I think if you have a brief slip, does that set you back to ground zero? I don't think so. I think it's a kind of a cumulative process in your brain healing. What I think is really important there, and hopefully you're working with a circle plan for your recovery, so you kind of have a sense of what's in your inner circle, that those behaviors that really indicate that you're in a relapse state, and the slippery slope in the middle. But what I found useful is to be aware of if you are masturbating, for example, and some people don't masturbate, some people do, and you know where it goes, inner, middle, outer, it depends on the person. But I think it's really what you're thinking about and fantasizing about at those moments. That almost is what really does more damage, and keeping those addictive related patterns in your arousal template alive, even though you're not using drugs, you're not acting out sexually. If we keep doing that, keep touching those and lighting those up, it's going to delay that the ability of the brain to kind of reset. So I wish I could be more specific with you, but the circle plan, the beauty of it really is that people can really evaluate on their own case-by-case basis what behaviors for them need to be abstained from, and which maybe can be safely pursued, and in what way. And so you have to really kind of evaluate that. We find it best to do it if you're working with a mental health provider, a therapist, CSAT, someone, they can guide you in that, and a sponsor. I mean, these are things that have to be kind of talked about and maybe even negotiated, and we find that it's really important to approach it as a contract, where you agree to do it and your sponsor countersigns it, and it can be renegotiated as things change, but it's really a kind of a formal process.
Yeah, when we do that with our guys who come to our treatment center, you know, they agree to be completely abstinent, at least while they're in treatment, which, you know, anywhere from 2 weeks to 4 weeks, and sometimes they stick around a little longer. I mean, in addition to what David said, it also gives a sex addict time to clear his head or her head, to get some clarity on what behaviors are problematic and what behaviors aren't. You know, when I came into recovery from my sex addiction, you know, I couldn't tell up from down, so I didn't know which of my behaviors were problematic and which of them weren't. I needed to step away, and I did 60 days in treatment, and you know, masturbated once while I was in treatment and didn't disclose. So I'm not very proud of that. But you know, it's hard, and you know, this is our go-to coping mechanism. So you know, sex addiction, we don't recover perfectly. I don't know any sex addict who's recovered perfectly. So please don't beat yourself up for not making it 90 days, but it's a nice goal to have 30 or 60 or 90 days away and get some clarity, and then figure out, as David said, you know, long term, what does masturbation mean to you? Is it part of the addiction? Is it a slippery that leads to the addiction, or is it maybe even a healthy behavior, which it can be for some people. So yeah, masturbation is a tough one for sex addicts.
Right.
Yeah, it's like an alcoholic keeping alcohol on the table right next to you. I mean, it's right there. You know, it's just tough to stay away from it.
Yeah. And I was just going to add, I think it's important to not just look at the behaviors themselves, but at the kind of the rituals that enclose them or encase them, right? So those are also equally triggering to understand, the role that your phone might play, or apps, or other kinds of behaviors that are all kind of integral to the addictive process. Really take a look at the big picture, and stepping away from, like Scott said, just gives you a chance to kind of figure out how those things connect, and may have the potential to trip you up or not.
Yeah, there's an exercise in Sex Addiction 101, the workbook, about the addictive cycle, and it kind of walks you through the whole cycle of sex addiction, but you could do that whole exercise specifically for masturbation, to see all the rituals and the fantasies and the triggers and the aftermath. So if you have that book, you may want to go back and look at it. If you don't, it's a good book to have anyway. Greetings, Dr. Fawcett and Scott. I had a fellow SA sex addict reach out to me today when he was about to act out. I was not by my phone and was not able to provide help. Later, he texted me back and disclosed he acted out. I felt a bit of guilt afterwards for not being by my phone. Is it normal as a peer to feel guilt if we are not available to provide support to a fellow addict before he or she acts out? Good question.
Yeah, it's a great question, and I think one that tells me that you're feeling feelings, right, and feeling some empathy there, which is something that some addicts, sex addicts, struggle with particularly. So I think that's, your connection and your compassion is laudable there, and noteworthy. However, I don't think you can take, I wouldn't take on the responsibility or even much guilt about that. It would be nice if you're available, but you're ultimately not responsible for what that person does. And I think we always tell people, and that's a practice I think for anybody in recovery, is to have a list of several people they can call, including, we've talked about this before too, having a list of people that you can call 24 hours a day in the middle of the night, because that's oftentimes when we have those problems. So it's nice to be available. I think if you make a commitment that, yeah, I'll be here no matter what, for a certain period of time or something, then that's a different story. But I think, we rely on each other in this program, but we can't just rely on one other person to do that. And I think that's important. So I understand your guilt. I think I might feel that too, but ultimately it's not our responsibility. We're responsible to be there in the best way we can, but that doesn't mean we're a 24-hour companion for everybody, in my opinion anyway. Scott, do you have any thoughts on that?
Yeah, I would agree with that. I made the mistake of saying in an AA meeting one time, I'm available 24/7. What I meant was I'm available 24/7 in an emergency. So some guy was struggling to sleep and called me at 3:30 one morning just to chat. And I said, "Are you about to drink?" No, I'm like, "No, dude, you misunderstood me." But people have jobs and things to do, and we're at the store and we're paying and we can't pick up our phone right away. Don't feel guilty about it. And what I would say, my experience as an addict is that usually if I pick up the phone, it doesn't matter if the other person answers. I can just leave them a message and say, I'm struggling, and that's enough to stop me, because taking an action against my addiction, whether somebody's there to receive it or not, is typically enough for me. And I think most addicts, my sponsees, I always tell them, look, if I'm in the middle of a webinar or something, I can't pick up the phone, but I'll call you back as soon as I can. Definitely leave a message. And they generally tell me, I'm fine now. By the time I get back to them, they'll say, just leaving you a message was enough, but early recovery, maybe not. This other person may be very early in recovery, but it's not on you.
Yeah.
Hi there. I'm losing my voice today. I'm a female who has been in individual psychotherapy for the past 8 months. My therapist recently suggested sex and love addiction as a part of what has been going on with me. After the initial shock and taking it all in, taking it all in the term sex addiction, I started listening to Dr. Rob's podcast. Both Dr. Rob and David have podcasts, which you can find on our website. The podcast has been a very helpful starting point, and I'm now going to In the Rooms, and just last night started the women's group on sex and relationship healing. Good job. My question is, I am so new to sex addiction and even addiction in general. What do I do next? I don't know what sobriety means. I don't know the steps. Any suggestions about getting started? Great question, and a huge one.
And congratulations on what you're doing. These, they're really the core, I think, of these recovery activities are getting connected. And whether it's in meetings like this or in the rooms or webinars, it's really about connecting with the sex addicts and learning about this whole phenomenon. In terms of what's next, I think I would get some of the literature and read, so you're starting to get familiar with the terms. There are 12-step guides for all the fellowships that and books that describe those fellowships that are available, the Green Book, for example, and that really kind of lay it out in a literally step-by-step way of what to do. And there's workbooks. There's a lot of stuff that's very helpful that I think kind of will provide some clarity. There are several different S fellowships that have kind of different angles on them, and you might want to experiment with that and see where you're most comfortable. For example, they may have more women than others in one fellowship or not, and just kind of find your way there. But I think it's going to be important for you not to just go to the webinars and these groups, but to actually attend some of the SA groups of whichever fellowship to get a sense of kind of these next steps, the practical steps and the tasks that lie before you. But it's really the key, I think, is what you're doing. You got a great foundation already. The connection, right? The connection that knowing, first of all, you're not alone. Knowing what this term is, I think when everybody hears that term for the first time, as it pertains to themselves, there's a bit of a shock there that goes on. But I think you're in great shape having the foundation of a relationship with a therapist already, who can also guide you with this, who's even suggested this. So I interpret that to mean that he or she is savvy to this whole phenomenon and can really be helpful for you. So I think you're really in good shape. But in terms of next steps, I would really try to connect with one of the fellowships and see what's going on, get a sponsor, and start doing the work in that sense. And I think it'll all become clear. It's a long process, but it's incredibly rewarding. I think you'll find your way. There's also, I think, I guess you're limited probably no matter where you are right now to online rooms. So that may be your choice right now. As the world opens up again, you can go and really get a sense of in person, some of the rooms and fellowships. But congratulations on that. These are huge steps. I think some of the big initial fight people have is denial and really not understanding this. And it sounds like you've kind of moved into this idea of at least somewhat accepting and taking a look at it and being open. And that's the exact correct place to be. So congratulations and good luck to you.
Yeah, just to echo some of what David said, I'm glad you have a therapist who's in tune enough with what's happening in the world to say, hey, maybe you've got a problem with sex and love addiction, because a lot of therapists just don't. It doesn't register with them. They never even ask questions about sex or romance. They'll let you go on for years and never tell them what's driving all of your depression and anxiety. I know that from experience. I would suggest, in addition to Dr. Rob's podcast, you pick up the Sex Addiction 101 book, not the workbook, the regular book, because it talks about sex and love addiction, and it's sort of soup to nuts. It'll tell you all of it, what it is, what it looks like, what recovery looks like, how to get started, how to find proper help, all of that. It's a great starter book for somebody who's new to sex or love addiction recovery. And the workbook is great too, but the book with the information is called Sex Addiction 101. You asked about the steps. On our seekingintegrity.com website, not Sex and Relationship Healing, which is where we are now, seekingintegrity.com, I wrote a series of blogs about the steps and how to work them. Very basic, very straightforward. So you can go to seekingintegrity.com, just Google step 1, step 2, it'll pop right up for you. Or you know, use the search feature on the site. Let's see, what else did I want to talk about? David earlier mentioned circle plans, inner circle, middle circle, outer circle. For people who are new, and you know, we have at least one new person here. In alcohol recovery or drug recovery, sobriety is really straightforward. You know, you're drinking and using, or you're not drinking and using. That's it. Sex addiction is much more like an eating disorder. You know, somebody with an eating disorder doesn't just stop eating; they'll die. We don't die if we're sexually abstinent, but you know, most of us have. You know, if I never get to be sexual again for as long as I live, I'm not interested in recovery. And so we treat it much more like an eating disorder, where we figure out what behaviors are problematic for me and which behaviors do I want to have as part of a healthy sex life. And to do that, we create what we call a circle plan. And the inner circle is our bottom line behaviors, our acting out behaviors, our non-sober behaviors. And they differ from person to person. You know, it may be pornography, it may be affairs, it may be whatever. Then we have a middle circle, which is kind of slippery stuff, slippery thoughts, feelings, and behaviors. I know that when I'm feeling anxiety, I'm slippery and I may slip into my inner circle. You know, if I argue, or I'm keeping secrets, or I'm driving through a certain neighborhood, it's slippery. It's not a bottom line behavior, it's slippery. And then we have the outer circle, which is all the healthy stuff we can do to replace our addiction, like, you know, working on my recovery, listening to podcasts, reading Dr. Rob's book, you know, hanging out with friends, seeing a movie, you know, planting flowers, whatever it is we're into, you know, that's an outer circle activity, going back to school, all of that. And that's explained in Dr. Rob's books. And I definitely encourage you to pick up Sex Addiction 101. As far as 12-step meetings, David mentioned they're all a little different. You said you're a female. Generally, the best group for females is Sex and Love Addicts Anonymous, SLAA. There just tend to be more women there. It tends to be, all the groups are welcoming to women, but that one tends to be more welcoming, and you're going to find other women there. But SAA, Sex Addicts Anonymous, will also be welcoming. Sexual Compulsives Anonymous tends to be more of a gay man's group, but a lot of women go there because it's safe. They're, you know, if they're straight, they're not going to act out with a bunch of gay men, or at least the gay men aren't interested in acting out with them. But SLA is probably your best bet. So thank you for being here, and welcome. And
yeah, it's terrific.
You're on the path. Type questions into the Q&A for us. So we got a couple more lined up here, but plenty of time left. Great topic. One of my PAWS, post-acute withdrawal syndrome symptoms, was really bad tinnitus, ringing in the ear. Thankfully, it has mostly gone away. Today, I realize that it's also a signal that I am experiencing acute stress. Knowing that has been helpful. Have you heard about tinnitus as a PAWS symptom, David?
I have actually not, but it fits. I'm totally not surprised, because I was talking before about these like weird body symptoms, right? Weird physiological things that can happen that are linked in ways we may or may not understand. So it makes sense to me. And also what he's saying, I think is great, in that he now knows that's a symptom of stress. And I think if we learn how to read our bodies and pay attention to what's happening, there are many great early warning systems. You know, I believe long before I'm consciously aware of a feeling, I'm kind of feeling it somewhere in my body. And I think it's important to pay attention to that. So yeah, taking that, unfortunate, that's not a fun thing to have, but to really then understanding it goes with stress, and that it may be related to that acute stress, which is a problem for recovery as well. So it's great. But I think just kind of taking an unfortunate symptom, but understanding that, gee, this is how my body works, and I can pay attention to it and prevent bad things from happening by paying attention. Right?
Yeah, I think David makes a really good point. some of the post-acute withdrawal symptoms I had, when I start to feel them again, I know that something's going on in my world and I need to slow down and back off and look at my life. And I've been sober a long time now, but body pain for me in particular will crop up, and for no reason. If I did something physical and I have body pain, I know why it's there. But when it's random, I know that something's wrong in here, and in here in my heart. So I have to look at it. Let's see. I certainly remember the experience of post-acute withdrawal from my first weeks and months of recovery from sex and love addiction, with the large porn component as well. But now, 6 years into recovery and currently with 18 months of sobriety, the same feelings come back with major triggers. I'm working at recognizing my successes and victories and not returning to acting out when the triggers come, but it can be shocking when the feelings come up after so long in recovery. Just hearing this makes me feel a little bit bad about not working a strong enough program, because I'm not past this at this point in my recovery. How can I best recognize this without having it provoke a shame spiral? Good question.
Yeah, great question, great comment. I just have to say the quality of the comment and insight in these questions is really terrific. So what Scott just mentioned, many years into recovery, like a weird body ache. I have the same thing. I just celebrated a big milestone in my recovery this past week.
For 41.
41 years. And when thank you, day at a time, a lot of days at a time. When I am still under stress after all this time, or I may not even be aware that I'm under stress, but I have very specific body things that happen to me, different cramps, different aches, stomach stuff, throat issues. And so it's like predictable. And I know it's just my body's way of telling me, hey, pay attention to this, slow down, take care of yourself. And so it's just, I don't have shame about it anymore. I'm actually grateful for it, because it's my way, because I still, even this long in recovery, well, one of my character defects is just pushing and not stopping and falling out of balance. And in terms of workload and stress and leisure, and so my body finally says, hey, wait a minute, stop. And so I start to pay attention to that. And so I would encourage you to just note it, make friends with it. It's not something to be ashamed of. It's not something to move past. I think these are things that obviously we don't want to suffer and have a lot of these weird symptoms, but I think certain ones of these may sort of become embedded, like the tinnitus or the body cramps or my throat stuff that just, I know for me, is something that I have to pay attention to. So I'd encourage you not to judge it, and in fact, be grateful for it, because it's probably helping you stay on a recovery track with a little easier time than you might have otherwise. So, do I want to have those feelings? No, but when they happen, it's like my body's telling me, hey, wait, you gotta pay attention to this. You mentioned this term that I don't think we've mentioned here in a while, the whole idea of a shame spiral and shame. And I think it's a really important concept for people to be aware of, because really shame, which is that sense that I am flawed, there's something wrong with me, right? I'm inherently bad, or a lot of the guys I work with in my private practice talk about feeling like damaged goods, just this sense of there's just something wrong with me that's almost beyond repair. That's shame, and that really is a terrible place for an addict to be in. Shame is a common thing, a part of the addictive cycle we've talked about. Shame is a driving force for setting up us for addictive behaviors, for fueling the addiction. So shame is something that we really feel is not productive. And this idea of a shame spiral is like, when it starts, we can just fall into it. And I think every addict knows how to really feel the shame very fully. When I'm in that dark mode, I can really kind of embrace my shame, and it takes me right to the bottom. It's like dead weight, and it's not a good place to be. So if anybody is starting to feel shame about something, deal with it, cut it off, talk to somebody, but don't allow it to kind of take hold and catch fire, because it really is destructive. So I think, congratulations just being aware of that, wanting to stay out of that shame spiral. But you've 6 years and now 18 months of sobriety. That's good recovery. And if you have things that happen, don't look at it as like a flaw, but something that just is keeping you on the track.
Yeah, I really identify a lot with this question. I've been in recovery for 20 years. I've got 18 years sober from sex addiction, and I'm coming up on a birthday from substance abuse. So it'll be 16 in about another week or so. And sometimes I feel like I should be well, or am I not fixed yet? Because my brain, I still get triggered. My head still spins. I still lapse into addictive fantasies, and it's like, really, after all this time? And it's just part of who I am, and I've had to accept it and just make friends with it. David mentioned making friends with this stuff earlier. Yeah, and I have to make friends with it and just say, okay, you're here, you can have a cup of coffee, but then you got to go. Not one of my good friends.
You triggered me to share something else, Scott, too. And I think, having an anniversary like I've done and being a therapist, I'm often very conscious when I share in meetings and feel self-conscious and feel compelled to always share happy things or things with great wisdom. And sometimes I'm just not in that place. I have stuff in my life, things go on. I have bad days, I have really bad days, I have great days, but I need a meeting where I can be honest about what's going on. And so I really try not to fall into the trap of everything I say, of judging and polishing what I need to share for how it might be perceived by somebody else, thinking that I have this burden of having to be all knowing and all perfect all the time. And that's just a real setup for me. So I've really had to force myself to give myself permission to really just share stuff, including stuff when I'm having a bad day. And ironically, I think it helps people if they see somebody who has time but may not have it together on that particular day. I think that's good for everybody, frankly. So just please don't fall into that trap either of like thinking you have to be perfect or pristine in all your feelings and everything. It's a real trap.
Yeah, I'm the same as David with that. I have a meeting that I go to every week. Well, now it's online every week. So I sit here and have my Saturday night meeting every week. And it's an AA meeting, but those guys have known me from the very beginning and they know what a crazy mess I am. So I let myself be a crazy mess on Saturday nights. And everybody's like, God, your shares are so honest. I'm like, oh yeah, but this is the one place where I feel comfortable just roll. So I make sure I have at least one place where everybody can know my crap. Because, sitting here, I feel like I don't feel like I have to put on a show, and I try to be really, really honest, but yeah, I want to be helpful and give useful advice instead of just whining. And sometimes I need to whine,
Right.
So, okay, my husband is a recovering alcohol, porn, sex, nicotine addict. Should he be in a separate 12-step program for each? Excellent question, and have a different sponsor for each? Wow, that's a really good question. David?
Yeah, really great question. And this is not uncommon, right? I think a lot of us have different drug issues and or a sex and porn addiction on top of it, or we're gambling on the side, or whatever we're doing. And I think it does get kind of confusing. And I have mixed feelings about some of this because I think there are certain fellowships that just don't do service to other behaviors, right? There are certain, I got sober and clean mostly in AA and NA, mostly AA. And AA, at least where I live, really doesn't tolerate a lot of talk about sex or anything else really. And there's some old-fashioned meetings here that won't even talk about other drugs, just want to hear about alcohol. That's gotten better, I think, but sometimes I think it is necessary, especially when you get into sex and porn addiction, to go to some of the S meetings where they really have an understanding of the specific phenomena of that, especially these behavioral or process addictions where the recovery is different. You know, Scott laid out the idea before where we can't just give up sex or we can't just give up food. So the recovery has to be different than just abstinence. And some of the drug programs don't have to do that, right? And so we have to kind of figure it out. Now the danger, I think, is spreading ourselves so thin that we're kind of not home anywhere. And so I've had clients with some success go to maybe 2 or 3 fellowships. I think beyond 3 gets a little dicey sometimes because you're just running yourself ragged and not really embedded enough in any one fellowship. And then in terms of sponsorships, that's also tricky because you may need a sponsor in A or NA, you may need a sex addiction sponsor as well. But the more sponsors you get, it's like having 2 therapists. There's a danger of triangulation, right? There's a danger of mixed messages and confusion. So I recommend where people have a primary sponsor in their primary fellowship, if they can identify one, and then kind of have, I wouldn't call it a co-sponsor, but have a person identified in the other fellowships they can talk to and work with. But I think it's a danger to get spread too thin. But I do recognize that not every fellowship can handle all the different problems. And that's one of the things, you know, with chemsex, which is what I do, where the fellowships, even CMA, Crystal Meth Anonymous, has trouble dealing with some of the sexual stuff because their focus is on methamphetamine for the most part. And so even there, where sex is more a normal part of the conversation, it still often isn't addressed totally. And certainly the sex addiction piece is not really addressed well at all in those fellowships. So, you know, it's hard. I think I would choose, though, a primary fellowship and maybe a secondary and maybe a third, but I'd be really careful about spreading yourself too thin. For example, in the things you mentioned, I think nicotine could easily be accommodated with an AA fellowship, right? Or NA. And porn and sex could be in another S fellowship, and maybe those 2. But I think the danger always is running. The other thing, by the way, in my mind, is that one of the important things about committing to a meeting is making that commitment and showing up. And there's an accountability piece there. So if I am going to so many different fellowships that nobody ever really expects to see me, that's a bad situation. I would rather be in a meeting where if I go every Thursday night and I don't show up for a couple of Thursday nights or one Thursday night, people are going to say, "Where's Dave? You know, what's going on with him?" And just, I want to be missed. And so I think we can kind of hide out in too many fellowships and not really connect. So there's a danger. But I do recognize the fact that one fellowship can't fit all sizes.
I'm an alcoholic. I'm a drug addict. I'm a sex addict. When I first moved to Palm Springs, there was sex addiction recovery was sparse and not a lot of sobriety. So I tried to make do with just AA. I learned a long time ago that I only need one substance program. You know, my substance abuse is substance abuse, and AA does me just fine there. What I found was I also needed to go to sex addict meetings regularly, to the point where I was driving into LA once in a while just to catch a meeting. Just thankfully, sex addiction recovery has really improved here in Palm Springs. It's actually very strong now. But I limit myself to 2 programs. I could probably go to CODA. I could probably go to the eating program lately during quarantine. A lot of boredom eating and stress eating, and that's a whole other story. But I limit myself to 2 programs, and I go to the same meetings every week. And as David said, if I'm not there, the phone rings. Where are you? Are you okay? You know. So yeah, and having a different sponsor for each, that's another really good part of this question. I sponsor 3 people. They are all sex addicts, but they are all also alcoholics and drug addicts. So they have one sponsor because I can deal with all of it. And, you know, and all of them had a substance abuse sponsor in the beginning and said, you know, I think I just want one sponsor. because they're splitting and you play them off of each other. And yeah, there are reasons to just have one sponsor, but if you can't find one sponsor who can handle everything, you better have some other backup sponsor-ish people in place. So, is picking or scratching on scabs a sign of possible porn, sex withdrawals, or meth withdrawals? I added that little bit myself. I'm at day 67 of sobriety currently.
Yeah, that's an interesting question. So picking is a common phenomenon, especially with methamphetamine. I've heard of it less so with porn and sex, although it really relates to an underlying kind of anxiety condition. In some cases, methamphetamine, it's actually called formication with an M, like Mary, formication, which is this psychotic feature of imagining there's bugs under your skin, and so people scratch at that. But I think with sex or porn addiction, you're not really talking about the psychosis piece that you get with methamphetamine, but you're talking about like a nervous anxiety reaction that's kind of a compulsive kind of an OCD kind of thing. So I mean, is it normal? No, I've heard of it. It's not totally strange and unusual, but I think it probably relates to anxiety or obsessive compulsive issues. And that may be one of those cases where a medication like an SSRI, which is a non-mood altering drug, might help with that. I think that's one of those situations where I might refer someone to their doctor to talk about it, because it's one of those things that can persist longer than you might want, and it can be really kind of destructive. A lot of the people that do that end up getting little staph infections on their skin, and just it's bad. So I think it requires maybe a step up in terms of intervention and doing something about it. Yeah, it's kind of a nervous thing. We with methamphetamine particularly, and some drugs, there's what we call stereotypic movements that are kind of repetitive motion things too. So there's a lot of repetitive movement. There's a lot of formication, scratching, especially with meth, but also with some behavioral addictions, but not as frequently. So I would definitely get it kind of checked out and see what's going on there. It may be really just anxiety expressing itself. The other thing that happens with any kind of, and don't be offended, this is a strong term, but it would be classified as self-mutilation, is what we would call that categorically. And sometimes, or maybe more than sometimes, that relates to trauma and unresolved trauma, kind of working itself out in terms of feeling something, giving expression to internalized pain, that kind of thing. So it might be, again, something to check out if you feel you've had some trauma in your past. And trauma looks, by the way, not like we always think it looks sometimes. You know, of course, there's physical abuse or sexual abuse, but there's emotional abuse, there's neglect, which can be traumatic, which doesn't look like you might think. But so it might be worth a peek and see if that fits, and then get some help for that.
Okay, this next one is going to be our last question, most likely. So this is from an individual who thought her partner was sober for 3 years and has learned during quarantine that's not the case. So they're going through discovery again. The question part of it is, now that we are going through this again, I've made it clear that my partner needs to do the work, and I am seeing improvement. But I feel like I'm still in the dark about what he is doing toward a true recovery path. What should this look like, and what is it fair for me to ask for or expect? This is a question we get from betrayed partners a lot. It's like, I want to know how much can I reasonably know, or should I reasonably know?
Right. So first of all, I'm sorry. This is something we're seeing a lot right now. Our unit in LA is basically full, and it's from people that are being discovered because they're in quarantine, and very much the situation, and the addiction becomes obvious because it doesn't stop. So partners want to know, and I think we do that. We unfold this in a very methodical way through a disclosure, a formal disclosure, when someone can work it out. And what we want to prevent and it's really for the partner's sake, is what we call rolling disclosures, right? Where the person may tell you, like in this case, I've been sober this long, well, you find out he's not. Or I'm doing X, Y, Z, and they find, well, no, you're not. And this is kind of rolling disclosures that once they get caught, they kind of reveal this, but not the whole story. And that's incredibly traumatic and painful for the partner. And so what we do is try to do a formal disclosure, which actually takes some time to prepare. Both the partner and the client have their own therapists that help them prepare for this. And the disclosure is a formal document that's read. And it really is a summary of what's going on. We try not to include every painful detail that would actually be more hurtful to the partner, although the partner has a right to know what kind of things has happened, with whom, if it's someone, especially if someone the partner may know, so that kind of thing. But it's a very formal process that it really is designed to get it all out on the table at once and be done with it in a really honest way with a lot of integrity. And
then in terms of what the addict is then doing for his recovery, how much should the partner know about that? What role should the partner play? How involved should the betrayed partner be with the addict's recovery and what he is doing?
Well, I think really the addict has to, I mean, my mind is that the addict and the partner both have to kind of go on their recovery journeys on separate pathways for a while, right? There's a lot of healing that needs to be done for the partner. There's a lot of trauma, usually PTSD, in fact, and a lot of betrayal issues, trust issues that the partner may need support with. And the addict really needs to do their own work as well and start to get a handle on empathy for the damage they've done, on the scope of it, breakthrough denial, all the work, the early work of an addiction. And then in our experience, that's why that formal disclosure should happen a little bit down the road once things are kind of stabilized for both parties. But every partner wants to know what's going on and know in great detail. And the partners of sex addicts are the best researchers in the world, right? They're on it. They know more about sex addiction than a lot of therapists do. They know more about where their partner may or may not have been than people know. I mean, they're really engaged. And that's seeking safety. They're trying to get reassurance. And so I think I would get support for yourself. I'd make sure your partner is in a process where he's heading toward a formal disclosure. I think what you may feel like you want in the short term is to know everything now. And I think it's really much better to kind of put everything together in a formal way so you don't experience kind of a blurting out over a period of days or weeks, different things where you keep thinking, okay, well, that's it. And then there's something else, and there's something else. It just causes a lot more pain.
Yeah, a formal disclosure, she asks, how far down the road does this take place? It's usually in the 3 to 4 month range is what most therapists will shoot for. Because the addict needs to get his, I'm going to be sexist and say his head straight and figure out what the truth is, because we lie to ourselves. We have to clean our own heads up before we can actually tell you the truth. We have to tell ourselves the truth first. It's a process. And by the way, usually as part of disclosure, the addict will say, there's a book by Stephanie Carnes called Courageous Love that just came out that talks about disclosure. And it is a multi-tiered process. And kind of part of that process is the addict says, I commit to doing X number of 12-step meetings a week and to do my individual therapy and my group therapy once per week and this once per week. And I will tell you if this happens or this happens or this happens, So that's actually part of the disclosure process. And once that happens, you should really expect that to be followed to the letter.
I might add, on sex relationship healing, we do have webinars for partners that you might find support in. Several, actually.
Yeah, and for couples too, which is cool. So thank you, everybody. We've run over a couple minutes like we always do. So we're going to have to cut it off. David, thank you, as always. Anything you want to say to take us all out?
Just remember, post-acute withdrawal, it can look weird, it can feel weird, it's probably normal, and just keep on the path.
Thanks, everybody. We'll see you next week.
Good night.